Hi everyone, this is Ernie from Samson Medical. If you're watching this video, it's probably because you are used to and familiar with the 24K small volume fat grafting system using the TP101N FPU, which is this one here with the piston and the green cap. So for those of you who are used to this, you will know there was a little screw that you need to remove from the piston, and then you attach the tire lock, etc. So this is the old version that we've been using for the past sort of 7 years. And this has now been replaced by a new one. So the new one is the SS100 FPU, or fat processing unit. And we call this one, new name, Smart Syringe. So this Smart Syringe is still 50 cc's. It's still the same thing. There's a piston here, except now the piston has an automatic valve. So there's no need for you to undo a little screw anymore. And instead of the green cap, there's now just a standard sort of lure lock bung, because the other change is that the syringe is now a lure lock fitting instead of a sort of proprietary standard screw in tip. So this is now lure lock, standard lure lock fitting. So what I'm going to do is just take you through very quickly how to set this up. And there's also going to be a couple of new tools or new instruments that replaces the old tool set. So you won't need the push stick, you won't need the old tire lock. This is the new one, which will be in your trays, sterile. So once you've opened up the pack, you're going to have that little plastic bung. You're going to have the syringe body itself, and of course the new piston. So grab your new tire lock or the new smart lock. The only difference being the fitting here is now a much bigger, rounder one instead of the little screw. So this now fits onto the end of the piston. So if you have a look at the piston, one side you can see there's a very fine mesh, and on the other side is sort of the shiny silver ring. So that side, the silver shiny ring, is the side that you screw the tire lock to, or the smart lock to. Make sure that's on relatively tight. Then you push that into the syringe like you normally would, all the way to the end. Now making sure that the locking system is 90 degrees to the flange. Then once you lock that in, turn it 90 degrees so it's locked properly. And I don't know if you can see that. Make sure it's locked properly. And then push the button to push the plunger, same as before, no different there. Once it's all the way down, grab your cannula, that your lure lock cannula that comes with it, and attach it. So it will have that gold fitting or gold hub. So grab that, and now it's ready for fat harvesting. So you can now hand that over to the surgeon, and then they will just do the same thing that they've always done, insert it halfway into the patient, and then pull it back approximately halfway, start aspirating. Once they finish, keep going. So let's say we've now got the 50 cc's. So still harvesting 50 cc's of fat where you can. Now, once that gets handed back to you, same thing as before. First thing, just remove the cannula. Now, instead of putting the green cap back on, obviously put that little bung back on there, okay, instead of the green cap. So a little plastic bung that comes with it. It's a little cream colored sort of bung. Put that on. And so you secure that. Then the next thing, same as before, you're just loosening the plunger of the smart lock / tire lock. Pull that back so you can see it's completely detached from the piston itself. Turn it 90 degrees, same as before, and then just pull it out. Now this got an automatic valve, so you don't need to worry about it's anything falling out as long as the bung is on this side. So with that, same as before, if you are using multiple FPUs, make sure obviously they contain the same volume. As long as they're the same volume, then now you can just put them straight into the centrifuge without having a little screw that you need to loosen like you did before. So just simply put them in. Or if you're only using one, put the blue balancer on the other end like you normally would do before as well. And once you've finished spinning it, so same, the spinning centrifuge protocol is still going to be the same, 3400 RPM for 5 minutes. Once that's done, you'll see the layer of oil on top. Pour that out like you normally would, and then grab this new plunger and screw it into the piston. So you no longer have to use that push stick and the plate. This is now replacing it. And then take the bung off it. Now the bung might be a little bit tough, so you might need to grab a pair of forceps or some clamps or something and undo them, because once you spin it, it gets really tight. So once you remove the bung, then it's time for you to remove all of the waste, the red blood cells and all the tumescent, etc. So with the new plunger, all you got to do is just gently push. Once you've expelled all of the waste material, you'll be left with the pure fat, and put your lure lock to lure lock adapter and a 10mm lure lock syringe, and then you can transfer the fat onto the other side. Just simply push it across. And that's it. So that's the new FPU, or the new fat processing unit, which is much easier and hopefully will be faster and quicker for you to use. You don't have as many steps and as many tools to use now. This is the simple system. So hopefully this will be much easier for you guys and make everything quicker.